All right, so it's about time for a follow-up. We're about 12 days out, and I think I'm really solidly into what I would say is second stage or subacute rehab. So right now, we're thinking that things are healing. It's time to make them work nice. I'm not worried about overdoing it too much. I'm not having pain with normal daily activities like sleeping or walking around or any of those things. So I feel comfortable about advancing what I'm doing. I think it's important to start with saying that there's still some smaller rehab type work that will go on within this. Even though you're pretty pain-free, know that there's probably still some things you need to improve. So for me, what that's gonna look like in my rehab category would be first quarter extremity. I've always had somewhat of a low back problem, and knowing how important that the low back and the hip work together, it's important to me to do some sort of bracing to lower body movement piece to help me improve that pattern, knowing I want to go into full Olympic lifting, running and cutting, etc. The other thing I'll use is I will continue to do isometrics of my work for the day. That's my litmus test, just to make sure things are progressing, just to make sure I can hold the positions that I want to load and progress later in the day. The new part to my, what I would consider rehab, would actually be what I term motion restoration. So I said in the first video that I wasn't going to do any aggressive stretching during stage 1, but now that things are healing and I want to advance to more normal patterns, it's super important to me that I do have symmetry within my joints, or as close to it as my body can get. So the keys to mine will be hip flexor pails and rails and a hip internal rotation pails and rails, which is a structured, guided, active stretching program. I won't be using forced positions, I won't be using bands or anything like that. I'll just be using that with some isometrics to help restore symmetry moving into other pieces. So, skipping out of what we would term the boring rehab stuff, what are the big advancements of what we should be doing now? Movement's normal, speed's not. Just train. It sounds pretty simple, but really what I'm trying to say is I'm using what I normally would in training. I'm just doing it in a certain fashion that I know I can protect myself and that I have total control over what's happening. So I'm going to be squatting, I'm going to be split squatting, step ups, probably some hinging work, but I won't be doing it at my normal speed. So I'm going to use, again, positional isometrics, slow eccentrics, to make sure that I'm re-grooving the pattern, that I have full control through the entire range of motion, and again, is that second litmus test. So the cool thing about this stage of rehab for me is it really gets me in a good place where I'm just doing normal training. It just is a slightly different tempo and loading before I move on. And it also lets me know what my next check mark is before I move into pretty much stage 3, return to sport training. If I can hit all of my positions with great eccentric control, no pain, no shift or compensation, I know that I'm probably good to start getting into speed work. I think the other important thing to say about stage 2 is work what you can. So from here up, I'm totally fine. I have a completely separate upper body program that's at normal intensity, normal loads. I have some metabolic conditioning that's at normal loads, normal speeds, normal intensities. It's pain-free, it's not inhibited by my injury, so I might as well keep it as normal as possible. That way I just keep my normal training rhythm and my body just kind of does its thing and gets back to normal.